Good evening, everyone present here. I am Faraz from IGCP Group. Welcome all the participants on today's webinar. And let's welcome today's speaker with great honor, none other than Dr. Vijay Barat sir. And let me share some of the achievement of sir. Sir has done MBBS, MD, consultant allergist at pediatric pulmonologist, clinical immunologist, consultant at Sai Allergy Asthma Eye Hospital and Shaidri Hospital, Imamdar Multi-Specialty Hospital. And today, sir is going to discuss very important topic that is how to manage asthma allergy in monsoon. And to know more about this topic, I would like to invite sir and hand over this session to sir. Over to you, sir. Kindly proceed from here.
Yeah, thank you for the introduction and thank you all of you for being here. The monsoon has been already there in our country, and you must have seen like a lot of viral infections have increased, a lot of cough cold problems, sinusitis. Even this year, as the heat had been there, a lot of dust particles have increased into the global warming has been 1.1%, and that's why the pollen's potency has increased. And as these clouds are always there, this will cause this type of problems into the community. So if you see, specifically children's, they suffer a lot because they have a disturbed sleep because of the blocked nose, because of the sinusitis, because of the throat problems, fever, malaise, headache, loss of appetite. And then once they have such type of infection or cough cold, the weight loss is also significant. And 2 to 3 months to gain that weight, again the family suffers. And again they have a infection or cough cold, again the weight loss happens. So practically also in children's, it's very difficult to, and because it affects their studies also, again these require oral antihistaminics and all. The sleep is affected, the sleep cycle is affected, and they have the problems. So prevention is always better than treatment, I always say. So a basic, like at least because of the COVID, we have learned the hand hygiene, then preventive measures like mask use, a proper exercise, even to the children's also. When yoga and pranayama can be taught, then safer probiotics are there, immunomodulators are there, then supportive zinc, vitamin D, C, then some of the, like before sleep, the salt water gargling can be there. Then there are some safer molecules. Suppose some childrens they are prone for the repeated cough cold and all. We can have a montelukast like leukotriene receptor antagonist, and then the safer fexofenadine, bilastine, or levocetirizine also can be given for a longer period during that season, depending on the season. Like some of the people during the rainy season, some of the patients get a trigger during the winter. It's a very common presentation, and most of the time, these patients are labeled as a common cold. And you always know, like most of the people have upper respiratory infection to the variable degrees, and specifically the stuffy or rhinorrhea is there. Then sneezing, sore throat like pharyngitis, tonsil or adenoids problems, open mouth breathing, snoring. And some of the patients have a halitosis, white coating of tongue. Fever can be there. It starts maybe from the low grade or a high grade. Spikes also can be there. And uh, headache, then like loss of appetite. Generally, the symptoms are self-limited. Within 2 to 3 days, patient have a response. But many of the patients, they may have a 5 to 10 days symptoms. Then it can be underlying some inflammation. And so that's why to prevent the complications like pneumonias, asthma exacerbations, otitis, because 30% of these patients have a deafness also in the adulthood. And so we have to manage these patients properly. Mild symptoms already we discuss, and suppose a normal loss of appetite and all, some uh, even to reduce the gastritis and all, we can give lansoprazole, esomeprazole, or omeprazole, that type of way. And depending on the fever if the patient has, then safer is the paracetamol. But suppose there is a repeated history, then ideally these patients will require such type of nasal wash is there for the children also, and for the adults also. There are very good nasal wash available, very safe. Only thing is the water whatever has been consumed, it should be the boiled and Then again, lukewarm water should be there, and there are sachets available. Add it to that and wash it. So the mucus and these bacteria and viruses, the rich growth will not be there. Then depending on that, the safer paracetamol or ibuprofen paracetamol or the such of combinations. Then safer antihistaminics like desloratadine, levocetirizine, bilastine, fexofenadine can be given along with the montelukast if it is required. Then if some patients have a itching eyes and all, because 95% of the patients with rhinitis always have a itching in the eyes, watering and all. There, the agelastine nasal spray is also available along with the fluticasone or mometazone. This also can be given for a longer period also. Then some supportive like zinc, vitamin D supplementations are very important. Dextromethorphan and all these molecules should be lesser used because long-term use will have a the tachycardia or palpitations or even the drowsiness and expectorantazole whenever it is required. Rather than that, the nebulization or the inhalers should be preferred if it is an asthma. Then there are so many preparations to give an immediate relief, like oral parenteral steroids, and so much overuse steam is used. Steam should be used only when it is required, when there is a blocked nose sinusitis and to have a immediate relief, but it should not be a repeated one. Antibiotic and all should be with the expert advice for 3 days, so most of the patient won't require anything. Antiviral drugs also should be with the expert advice, not to be given over the counter. Because during the COVID, the people started using their own medications during the swine flu. It should not be happening. The specific cases only these medications should be used. Thunderstorms can make these allergies and asthma worse because of the events like these cold downdrafts, concentrate air particles such as pollens and funguses. Like during the rainy season, a lot of molds happen everywhere. We did a studies like during the kitchen deep pockets or into the freeze because of the vegetables and fruits also. The these are combined into the market yards. So these funguses they can come with there. Then these air particles are swept up into the clouds where humidity is very high. In the clouds, this wind, humidity, and lightning break up the particles to the size that can readily enter the nose, sinuses, and the lungs. And wind gusts concentrate these small particles, so large amounts can be inhaled. So that's why these patients during the cloudy weather and during the rainy season, they have a lot of triggers because of that. So you can see over here how beautifully it has been shown. How the pollens in a large numbers are pulled up, broken into the more smaller particles and speedily enter the nose and the airways into the eyes and they cause the trigger with that. You can see like these thunderstorms, how the gushing of the air happens and then they have a so these again there are things like the positive and negative charge happens. And that's why many of the patients have a significant asthma attacks or rhinosinusitis. So this is also very important. And this cold air also triggers the things. The upper airways should be considered as a functional unit. Many of the times, these patients are misguided that will increase your immunity and will reduce the symptoms of upper airway. But the Th2 inflammation, around 80% of these patients, there is a Th2 type 2 inflammation. And because of that, this secondary infection, they just trigger the attacks. So we have to manage the underlying inflammation. So not only the antibiotics or antiviral, but the safer montelukast and fexofenadine or bilastine, if they are given properly, the nasal wash is done properly, the nasal sprays are used properly, and with the safer, some soothing or saltwater gargling, will have a very good relief than the antibiotics and all. So if you see the mucosa, which is connected to the lower airways, all the same thing is there. We always say one mucosa, one disease. So while managing these patients, we have to manage the nose also very well so that the symptoms are less. So simple maneuver is that always teach the patients to sniff inside, and it does not require any severe like all hi-fi equipments and all. Always look care, listen carefully, feel, and measure the things. So it cannot be without in measurement. So even the simple blood pressure and the pulse ox monitors and all should be each and every clinic of ours. So then respiratory signs, fast or slow, then thoracoabdominal, abdominal thoracic. Children specifically abdominal thoracic or women's. The regularity, rhythm, then any retractions. If it is a ear retraction, it is a severe one. Accessory muscles if they are used. Then subcostal retractions and all, the lower airway can be involved much. And if it is just tachypnea, the fast breathing, it can be the nasopharyngeal, um, like oropharyngeal things also. Blocked nose also will have a difficulty in breathing, shortness of breath, but it may not be the lower airways. So a proper management of the nose will relieve that. And these six noises at the site of lesions we should remember as a practitioners. Snuffles, then it is at the nasopharynx. Snoring, it is at the oropharynx. Stridor, larynx and trachea. Rattling, it is at the carina. Whizzing at the bronchial tree. And grunt, it is the parenchyma pleura. If it is a grunt, it is an emergency. If it is a stridor also, laryngitis, it can cause a lot of problems. These two conditions, you have to rush to the proper, you have to give adrenaline nebulization, relieve the stridor. Grunt also, it will require oxygen supplementation along with the nebulizer or IV antibiotics or IV steroids should be given to these patients. Then during the coronavirus, we have seen that many of the patients they thought they don't have COVID, it is just common cold. And during the swine flu also, we have found the pandemic where a lot of children they lost their lives, elderly people. So we have to always remember these chart and we have to follow these patients accordingly. So that now this season the flu and pneumococcal viruses have increased a lot. That's why even the influenza vaccine and the PPSV 23 vaccine should be given to these patients during the rainy season. Specifically, even the high risk people like allergy, asthma, blood pressure, or diabetic patients should be supplemented with these two types of vaccine. And in the asthma patients, this pulmonary severity score should be by the Indian Academy of Pediatrics has been seen, and a simple respiratory rate per minute, and depending on the age and then the V's and the accessory muscle use, we can monitor these patients and we can guide the patient when to interfere accordingly. So pulse oximetry has to be in your OPDs, and we have to remember that less than 92%, it is always investigate the patient with the X-ray or whatever the reason, like asthma, if it is there, then accordingly the nebulizers. And again, the clinical criteria for the pneumonia, fever if it is high grade and all, cough which is not responding, then if it is the effusions, empyema, then depending on that, we have to assess the patient and then look for the signs of consolidation, hypoxemia, and depending on that, X-ray or CT scan also should be done whenever it is indicated. And less than 2 months, above 60, 2 months to 12 months, above 50, 12 months to 5 years, more than 40 respiratory rate is worrisome, and these patients should be investigated properly. Then community-acquired pneumonias, there are different type of, depending on that, if it is a very severe pneumonia, that patient even unable to drink or convulsions can be there, abnormality in sleeping and difficult to stridor or severe malnutrition also can be because of the chronic like a tuberculosis and all. Sorry, there was an emergency call from a corporate hospital. That's why. So this upper airway cough syndrome should not be missed because many of the patients we have seen that they are given a nebulization and inhaler, but their postnasal dribbling is the cause, like a sinuses and all. That postnasal dribbling causes the upper airway, and unnecessarily they are use a nebulization and all. So look carefully if there is a mucus and press the sinusitis signs. The patient, if it is complaining and all, it can be the upper airway, even the tonsils and adenoids. They will cause a postnasal dribbling in these patients. So you can see like this patient is having a posterior nasal dribbling. This mucus is there. You can see the periocular eczema and these long eyelashes, these Denny Morgan folds, and this is causing a chronic inflammation. This was a 4.5 years old child. At the 9 months, he had a rhinitis, but later on he had asthma. He had been to many of the people. When we did identified the allergens, there was a parthenium and dust mites. So some of the times we have to identify the cause also. So now there is some of the pollens, the funguses can be there according to the exposure. Suppose there is a damp wall, then the liquid ammonia 5% should be sprayed over that. The spores will not trigger that. Otherwise, the trigger is happening into the bathrooms and all, and we are unnecessarily using so much medications. So, whenever it is indicated, some tests should be done. Like this was a patient referred from one of the hospital. Last 3.5 to 4 months before coming to us, he was suffering with repeated cough cold, and the dust mite contamination into the peanut butter had triggered the child. Now he was having a repeated. You can see the long eyelashes. This was a 12 years old child, had went to many of the doctors he was investigated with, many of the things. But when we found he had a significant cervical lymphadenopathy, long eyelashes, protrusion of the teeth and all. And when we identified he had a sensitivity to the pollens, we guided him about the mask while going to the school and coming back. And whenever the wind used to be there, close the windows and all. He started showing good results. Then we desensitized against the pollens, and he had a very good recovery. And even it will stop the further. Yeah. So even many of the patients have a GRD. So along with the asthma patient, 40% have a reflux. That again triggers the pharyngeal irritation or adults also, and that can be the source of the chronic repeated cough. So the GRD also should be managed with the proper medications. So infants, if you see, they have a valry, GRD. If there is cardiac problems, then Todiaco should be done. Then any aberrant arteries and fibrous glands, they also can cause a cystic fibrosis, primary ciliary dyskinesia, immunodeficiency syndromes. Should not be missed. If there are uncommon infections, repeated pneumonias, repeated abscesses happening somewhere, these patients may have such type of severe underlying cause. Then toddlers, there are atypical wheezers, multi-trigger wheezers, exercise-induced bronchitis, asthma, comorbid rhinitis, sinusitis, adenoid, tonsillar hypertrophy. Daycare or school-going children will have secondary infections. And then there are some immunomodulators like pitotimod, then colostrum, then curcumin. They also should be supplemented to that. Underlying any structural abnormalities, and some of the patients, even the foreign bodies should not be missed. They also can cause a chronic cough and repeated cough. Then adolescents, if any passive smoking is there, lifestyles, obesity, airway eosinophilia, psychogenic also because to attract the attention of the parents and all, sometimes some of the patients can have. These are the common symptoms found in patients with upper airway cough syndromes. The cough is there, nasal discharge, draining sensation in throat, throat clearing is very common. A lot of people they go on going this way. So we have to identify that. The posterior pharyngeal drainage or mucus can be there. Frequent spitting. A lot of people go on spitting or sneezing that way. Or for the sinusitis and all, they will go to the counter and take a sinus 77 tablets and all. Congested nasal and sinus passages. Oropharyngeal mucosa, cobblestone appearance can be there. Bad breath, wheezing, constant attempt to clear the nasal passage, difficulty in breathing, chronic sore throat. These can be also very common problems. So, while examining these patients with a repeated cold cough or asthma, always examine is there any braces because that is because of the nasopharyngeal obstruction. Then polyps or turbinate hypertrophy. Then lymphadenopathy. The ear also should not be missed. Mouth, the cobblestone appearance like a how we see the artificial waterfall. Then always don't lose the skin. 70% of these patients have a dry skin, atopic dermatitis. Measure that also. Examine allergic signals like under the eyelids. I will show you the actual pictures as a practitioners how we should pick up these things. This is because of venostasis and rubbing of the eyes. This causes the allergic shiners there. Then this is a Denny Morgan folds or Muller's muscle spasm. Then this long eyelashes, watering of the eyes. Then this open mouth breathing. This allergic salute, very common, like rubbing eyes, ears, and all, should not also be missed by the doctors. This is a simple, it does not require any equipment. Just lift at the tip of nose and look at this underlying. Because as I mentioned already, Pune like city, Delhi like city, Kolkata and all, 80% of the people have these pollen potencies and the pollutants. This derriere line, horizontal, should not be missed. If you manage like facial grimaces this way, we should not miss that. And so that we should treat the underlying inflammation with the proper Montelukast levocetirizine and nasal sprays, nasal wash, or during that season, repeated antibiotics and oral steroids also can be reduced and they can have a good quality of life. This is a posterior nasal pharyngeal hyperplasia. So guidelines for the OTC products. A lot of people they just go on taking antihistaminic, cough syrups and all, central acting antitussives. They are very side effects are there. So don't use those. The safer molecules. So work with effectively with the parents. Explain that the oral antibiotics and steroids have long-term side effects, and then wait for a few days. If it is an allergic, you have to take for a longer period. If it is a viral infection, simple uh, like even curcumin, colostrum, or immunomodulators or some probiotics are now, they will have a very good relief within few days, or whenever required, some steam inhalation and nebulization should be given to these patients. Then you can see like so many deaths happen recently, even in Africa also. This was, I think, Delhi case. In Africa also, a lot of children died because of such type of contamination and as well as the over drug. Treat the root cause. So even nowadays there are some berry extracts and beta glucan and L-lysine and all to increase the immunity. Then zinc supplementations. There are some Ayurvedic medications also. This type of combinations we can use to have a relief for some time. And this is a very important. Each and every doctor, we should keep this questionnaire and always ask if anything happened for this patient during their lifetime, so that we can guide the patients if it is an underlying Th2 inflammation and genetic susceptibility. Even the parents, grandparents, first degree relative, somebody has a snoring or GI troubles or skin inflammation or sinusitis or ear problems or ocular allergies or something, we have to ask. And we have to stop the progress of the disease. As a practitioners, our aim should be to have a long-term relief and stop the progress of the disease, to provide the good quality of life, to prevent the complications. Like this child had already started a cataract because of the overuse eye steroids. Initially, he had a repeated cold cough during the seasonal, and they were already on the inhaler and nebulizers. You can see like this rubbing of the eyes is a very important symptom. This is because of the nasocular reflex. And again, this Th2 inflammation, if we manage properly, the Th1 immunity increases and secondary infections will go down. So don't over secure the child. Let him have a hygiene theory is there. Let the child play in all the mud and everywhere. And he built up his own immunity. And while managing this cough cold line patients also, these other comorbidities should not be missed. As I mentioned, if there is obesity, then CVTs, cardiovascular problems, and all, then the vaccine of flu and pneumococcal also should be given. Then microbiota balance with the good dietary habits, exposure to the sunlight, and exercise, and less exposure to the pollutants. Even the passive smoking by the parents, grandparents, BD cigarettes should be avoided. The sweeping at house, they go on dusting and that dust will be there. Strong odors like cooking or burning the firewoods, these also should be prevented. Like people use the misri and burn tobacco, that also should be guided to the patient. And some deodorant perfumes are used, or strong cleaners at the houses, they also should be avoided, because these seasons, to avoid the insects, people use so many such type of things. So remember the allergic march. Out of these cold cough patients or asthma, they are going into the adult asthma and complications. And don't forget about this. They can travel around many kilometers. They can be with the vegetable fruits 14 to 15 kilometers. Now during these days, the dust mites they increase a lot because of the humidity into the beds of house curtains. They kept into the intense sunlight. Now there are some agencies they come and clean those things. So to avoid the exposure in the school bathrooms and all, there are a lot of molds. So that the schools also they should be guided to use the liquid ammonia to prevent these spores. And then some of the patients will have a trigger with the foods or outside foods, and oily foods and all should be avoided. They should use a gargling and all. And in asthma, if you see, look for the other comorbidities and manage the GRD, sinusitis, obstructive sleep apnea, snoring, any other complications, and passive smoking and exposure to the air. And always do the tests also. As I mentioned about the allergy test, the same way, these lung function testing also should be done to prevent the further complications and severity of the disease into the adulthood. That should not be missed by these people. And these dust mites, pollens, funguses, animal dander, insects should not also be missed. You can see like 80% is the dust mites, then pollens, animal dander 92 to 95%. These are cannot be seen, and we have to improve the quality of the life and stop the progress of the disease into the further life. So early detection is very important, and whenever avoidance measures, then specific pharmacotherapies, as I mentioned about the nasal sprays and safer antihistaminics and safer cough syrups, should be used than the over-the-counter medications. And whenever it is required, then desensitization, again the pollens and dust mites can be done for the longer benefit of that, and safer second generation, third generation, so that the cognitive and behavioral disturbances should not be there. And whenever required, then only antibiotic and X-ray or other investigations. So you can see like how the safer standardized skin allergy tests are done rather than the blood allergy tests, which are not useful. So many advertises are done, but it is misguiding and unnecessarily the cost is very high. So you can see like the standardized skin tests hardly within 40 minutes the report are there and very useful to the patients practically. Hardly 100 rupees per allergen is the cost. Even nowadays we have a painless bloodless lancets which can help. In our hospital we investigated thousands of patients with the dust mites, pollens and molds during the rainy season, and now the these pigeons and all at the balconies and all because of the rains and their feathers and their droppings, they also trigger the things. And in these patients of cold cough early stage, if you identify the environmental control and we can manage that, it will have a very good results. When the World Health Organization has said since 1998 that along with the decongestive and antihistaminics and nasal sprays, mast cell stabilizers, oral or parenteral steroids, antibiotics, and all, the avoidance measures will definitely improve the quality of life, specifically during this rainy season, the molds, dust mites, and pollens, insect droppings, and dried feather. And whenever we desensitize, they will act against the mast cells, which are the culprit for this histamine release and all. Then eosinophils, they are very important, so they will reduce that and you improve the quality of life. So during the rainy season, managing allergies requires some extra precautions. Keep windows and doors closed, prevent pollen and mold spores from entering your home. Use air conditioning, like specifically plasma clustering technology, where dehumidifiers also can be used to reduce the moisturizer and preventing the mold growth. HEPA filters as a vacuum cleaners into the deep pockets of the car, into the kitchens, into the freeze and all. Avoid outdoor activities whenever it required during the peak pollen season or heavy rains. Wear the mask when outdoors while going to the school or offices and coming back because the vehicular exhaust and construction dust and all. Then change the clothes whenever you are going. Keep surfaces clean. Monitor the pollen counts. Consult a doctor whenever it is indicated rather than taking a self medications. Then control the humidity levels. Practice the good hygiene. Monitor the air quality. How we see the which movies on the which theater and all. Rather than that, use the flu shots and this PPSV 23 vaccines. Avoid dampness whenever there is a liquid ammonia 5%, and wherever it is required, carry the inhalers and allergy medications with you because in case of emergency, you will require that. If required, nowadays even handy-made nebulizers are also there, which can be attached to the mobiles also. Wear proper clothes and all to prevent the thing. Healthy diet is the most important. Hydration and all that should be there, and the breathing exercises wherever indicated. So mold proof products are also nowadays available. Dust mite proof products are there, and these also can. And whenever it is required, then desensitization or immunotherapy also can stop the progress of the disease. So thank you. Thanks a lot.
Thank you so much, sir, for giving out your valuable time and sharing your knowledge on this topic. I definitely think this session knowledge is going to help all the participants, sir, who have joined this session. We have received some questions, sir. With all your permission, shall we take this
Yes,
question?
yes, yes, please.
So the first question is from Dr. Aniket. He's asking what are the common environmental triggers during the monsoon that exacerbate the asthma and allergy reactions?
Yes. Even as I mentioned, asthma allergy is there, postnasal dribbling, throat irritations, sinusitis, otitis. These are always because of the weather change, the funguses, the dust mites, the pollens, insect droppings, as well as viral infections. They also trigger a lot, and specifically the flu, pneumococci, para-influenza, respiratory syncytial viruses. That's why now even the RSV vaccine is coming in India. Recently, the trials we are doing, it will be coming in India also. So these vaccines also should be given to these patients and use the masks and clean the house, not to dust. Always use the vacuum cleaner or electric brooms. So such type of practices should be also practiced.
Thank you so much, sir, for sharing your insight on this question. Moving forward, we have another question from Dr. Shubham, and he's asking how should medication regimens to be adjusted to account for increased allergen exposures during the season?
First thing is that see, it's like a diabetes. Suppose somebody the sugar is increasing. If you want to increase the insulin dose, And if the patient is eating a gulab jam and all, it's not useful. The same way, here, ideally, whatever the precautions should be better. And still, suppose the patient can't avoid these things, then the higher dose of anti-inflammatory medications like montelukast added on, as well as bilastine or fexofenadine, the dose can be increased to 2 to 3 times also. Nowadays, there are some biologics therapies like omalizumab injections and all. They also can be given so that they break these allergen and pollutants binding to the mast cells. They are the primary cells to reduce the inflammation. So such type of practices also can be used. Then the nasal sprays, the nasal douching, wash, these precautions also will definitely help these patients.
Thank you so much, sir, for answering this question with an example, sir. I hope it will be more easy to understand. Sir, moving forward, we have another question from Dr. Shivani, and she is asking, what role does allergen immunotherapy play in managing seasonal allergies related to the monsoon?
Yes, absolutely. Because see, seasonal allergy or perennial, most important is that allergy is a progressive disease. And symptomatically, the childhood asthma also 85% of the patients they work on the asthma. But later on, many of them are going into David and nasal septum, tonsilloadenoids, snoring, asthma, adulthood complications, allergic conjunctivitis, severe complication. So desensitization is the only way which will stop the newer sensitivity formations and the further progress of the disease and minimal persistent inflammation. So even hit hard and hit fast. Suppose like diabetes 140 sugar is there. We don't wait for the 500 sugar. Same way here. If there is a significant parental or family history of allergy, and somebody has a severe chronic respiratory disease and severe eczemas and they had a problems there, the children also in an early stage or anybody, if you manage them in an early stage, it is much better. You have to unmute. You are muted.
I have one feedback from Dr. Shivani. She has written, very much needed topic in monsoon season. Thank you for covering this.
Thank you.
And thank you so much, sir, for this amazing talk, sir. I hope, sir, I can see there is no more question. I hope, sir, you have done justice to this topic. That's why people are not asking questions. And, sir, as there is no more question, with all your permission, shall we conclude this session for today?
Yes, yes, yes. Please, please. Yes. Thank you.
And thank
Thanks a
you
lot,
once again,
everyone.
sir.
And thanks to MedTalk also. And
Yes, sir, and
bringing
more
topic.
like all thanks to you also. Like, sir, you are always ready to share the knowledge, sir. You try to reschedule your plan, and you must focus on the healthcare education more, sir. And we would like to thanks, and we would like to see you in future also in different topics, sir. And till then, take care of yourself. Thank you.
Thank you.